Dr. Tom has offices all over the place in Santa Rosa, Napa, and Maui. You can also find him online at drtomcosmetic.com. You can call for a consultation at 707-542-8346. 707-542-8346. He's been voted by you best cosmetic surgeon for 8 years. That's a long time. And best esthetician for 3 years. You can, of course, call now to book a consultation. And welcome, Dr. Tom.
Thank you, Michelle. And first of all, I want to introduce our guest, if I may, and that is Karina.
Hello, everyone.
And everybody will probably remember Karina. I think
I hope so.
We're going to change the name of the show from Ask the Expert to the Karina and Dr. Tom Show. And it's wonderful to have Karina here. And before I start telling the listening audience again about you, Karina, we need to announce something, don't we?
Yeah.
Somebody's birthday's coming up, right?
Yeah, Michelle.
Oh my gosh, you guys.
Happy
It's
birthday.
Michelle
Thank
Marquez, who is our producer here, and who started me on the radio many, many years ago. It's her birthday, so you're what now, 21?
Yep, totally 21.
Totally 21. All right, so happy birthday, Michelle. So for those who may not have listened to earlier shows, Karina is our medical assistant as well as our surgical assistant, and does our pre-op teaching and is just really an integral part. Thank you, Karina,
thank you.
for taking care of me. She takes care of me, and therefore it helps me to take care of her patients. And I know that the patients love her. And Karina, you're so connected with our patients.
Right.
Today, I thought what we would do is, from your perspective and just chatting with our patients, and what do you think are the major cosmetic concerns of our patients?
Yeah, I'd love to talk about that today with you and everybody listening at home. But I have noticed you have something new that you like for our patients, a new treatment.
Which treatment are you referring to?
I think SkinVive. SkinVive is making its way up there as your top favorites for this year.
Absolutely. So SkinVive, which is SKIN, capital VIVE, like to live. Okay, SkinVive is really a cool treatment.
Yeah.
We just started that around the holidays last year.
Yes.
And I've actually have had this treatment, so I'll speak a little bit about my own experience. So SkinVive, as Karina mentioned, is something you can tell from my voice. I'm kind of excited about it. It's an injectable hydrator. Okay, and Karina, you notice that we're doing it for all sort of age groups, right? So
everybody.
we're doing it for kids like you, right? Young kids, young adults.
Yes.
Yeah, okay. You might be a mommy too, but you're a kid to me. So young people all the way up to us aging baby boomers, and it's a great treatment. So SkinVive, Karina, is a treatment that is made of hyaluronic acid or hyaluronic gel, and everybody who even knows a little bit about cosmetic medicine and cosmetics knows about hyaluronic acids. And so what other treatments do we have that are made up of hyaluronic acids or hyaluronic gels?
Most of our fillers have that form.
Exactly. Yes. So in those fillers, which can be the Restylans and the Juvederms and so forth, they are made up of a hyaluronic acid or gel, and they're compounded at the lab to have a certain amount of thickness. Okay, and so we inject that into the skin or under the skin to kind of plump up or revolumize the face, add more volume to the face, or in the lips, right? One of our favorite treatments. Do we have any topicals that are made out of that?
Yes, we have the Dr. Tom Quench, the hyaluronic gel that is moisturizing for the skin. Yeah.
Right. You can tell that Karina and I have been working together because she wanted to say hyaluronic acid, and she knows that I call it hyaluronic gel because I'm afraid that people are going to think, oh, acid, that doesn't sound very good. But Karina is totally scientifically correct. It's hyaluronic acid, and you're right, we have a topical called Quench. Normally we just name what our products are, like this is Red Day, but it was really such a great product that we wanted to describe it with and what it did, and we call it Dr. Tom's Quench. And so what we're doing is we're quenching the thirst of the skin, and this is topical. We just put it on our skin. I use it twice a day, morning and night. Do you use it?
I have used it more in the winter months when I'm drier. I tend to be a little bit oily, so.
Okay, yes. See, so and so you can hear as Karina's telling you her experience is that it's customized. So nothing is right for everybody, right? So your oil, your in your 20s, okay, you're mostly Latina.
Yes.
I know you claim to be 100%, so, 100% Latina, and so your skin is a little bit oilier, so you use it in the winter months when it's drier. And for myself, because I'm an aging baby boomer, even though I'm Chinese and Greek, and we tend to have a little bit oilier skin because I'm older, it's not as hydrated as before, so I put that on topically, and I love it. So let's get to SkinVive. SkinVive is actually an injectable form of this hyaluronic acid. It's not so thick that we would use it for volume, so it's not a filler.
Right.
Okay, we're calling this an injectable hydrator. And what we do is, as we prepare somebody, Karina, how would we prepare a patient to have a SkinVive treatment?
Yeah, so SkinVive is, there's a lot of pokes involved, so we want to make the patient the most comfortable we can with a topical anesthetic that we leave for anywhere from 10 to 15, 20 minutes, just depending.
Got it. So what would happen is as Karina's described, is she'll put a topical anesthetic on the skin after you wash your face. And then I visualize the grid, although you will see some people drawing a grid, and I visualize it. And usually what we're treating is what we call the cheek area. So think about your cheekbones. If you touch your ear and then kind of move forward along your cheekbone, that area there, then go along the side of your nose down to your jawline, and then back to the angle of your jaw and back up to your ear. That's the area that we normally treat with SkinVive.
Right.
And so we put on a topical anesthetic. We use the tiniest of little needles, and the treatment includes 2 syringes of this hyaluronic acid, which is more, I'm going to say, it's not a liquid, but it's definitely more liquid-like than gel-like. And so what we'll do is, after the topical anesthetic is put on, and I've had this treatment myself as a patient, we'll inject little aliquots, just little aliquots of the hyaluronic acid into the skin itself, right into the dermis of the skin. And the reason that we do that, Karina, is that hyaluronic acid seeks water, and depending on which experiment that you believe in, it can attract up to 50 times its weight, and some people think it's up to multiple hundreds times its weight in water. So by injecting this hyaluronic acid in, let's say, 20 little spots, little micro droplets, is another way of calling it, micro droplets into the skin, your skin begins to absorb water. So when we first were experimenting with this, and we always like to try our treatments first on ourselves, right, Karina, before we offer it to our patients, because they need to trust that we're going to do what's right for them. You weren't around when we first did the first trial, correct?
No, I was not part of that treatment.
Okay. So I had it done on myself, and Mary, our lead nurse, and Sophie, our nurse practitioner, and then Melanie, our other nurse practitioner. They were all getting their hands in there, and I think they were getting back at me. They were injecting my face, and so I had a syringe on each side injected in my face. So afterwards, you not having been there when we were doing our experiments, was there anything that you noticed from a negative standpoint the next day? Because we work every day.
Right. Not specifically for you. Our nurse practitioner did have a little bit of swelling, not nurse practice administrator, but she was taking aspirin, so that was a little bit different. So maybe that side effects would be bruising, which can happen for anybody.
Exactly. So as with any needle, that's probably the biggest concern. So I had it injected in me, and about 20 little pokes on each side, and little micro droplets being injected into my skin, and I didn't have any bruising at all, or if I did, it was really microscopic. You'd have to get up awkwardly close to me in order to see that.
Personal space areas.
Socially, let's keep our distance here, right? And so I had that. When I ran my hand, did you notice any lumps on my face?
No, they were not noticeable.
Exactly, and that's the point that I want to make to our listeners, is that you really aren't going to see any bumps on your face, what you will feel, and I definitely felt that for anywhere from 3 to 5 days to up to about a week plus. If I were to run my hand on my skin, I could kind of feel the areas that I had been injected, but nobody could tell that it was. What I'll have to say is that I loved the way that my skin felt. So even though most people will say that I look young for my age, and they think it's ethnicity because I'm Chinese and Greek and so forth, then I, of course, do the treatments that we offer at our office, Karina, I felt like this was one of those wow treatments where I actually found that my skin just felt plump. And not that I have a lot of fine lines, I'm lucky that way, but I did feel like the areas where maybe I had some fine lines, that they seemed less because my skin was plumped up.
Right, and hydrated.
Exactly. And it was hydrated, and this is injected directly into the skin, which is what I like, versus a topical, which takes time to penetrate. Okay,
Right.
so this is the most effective way to hydrate your skin. Okay, hydrofacials, which I love, again though, are starting on the outside, trying to drive hydration into your skin from the outside in. With this, we're injecting it directly into the skin, so it's a great way, it's a great delivery tool to hydrate the skin. You had mentioned, Karina, about our practice administrator, and then, you know, she had been on some aspirin, so she had a few, and she's Northern European,
Right.
and so they, Northern Europeans tend to maybe bruise a little bit more than Latinas and Asians, okay, that she had a little bit of bruising, but what did you notice on her skin?
I definitely saw a more radiating skin. It did look plumper, a little bit more plump. And even though she did have the bruising, overall it looked better. Her skin looked better.
Right, and I think that you were really astute in what you just said. So her skin looked plumper, even with a few little bruises. Her skin looked plumper. And I immediately noticed the next day how good she looked. And when I asked her, and again, remember our listeners, you know, we're trialing this because we want it to be able to offer you the best, and we want to know what that experience is like and what is the long-term effect. And I noticed that she looked better right away. She was not convinced.
Yes.
Okay,
Yeah.
she was not convinced at all for a couple of days, like, oh, I'm not so sure that I like this treatment, right?
Right.
And I think part of it was just because she was on aspirin and she saw a couple little needle pinprick bruises for her. Okay. After about 3 or 4 days, and if you were to ask her, she would say, wow.
Yes.
She said, I love this. Okay. So it took a little while for her to kind of get over a little bit of that bruising, which if we know that you're a bruiser, what would we put patients on?
We would ask them not to take blood thinners before.
Right, like aspirin, fish oil,
right?
okay.
And we would want them to, we would ice more. And
Ice
hold
more, okay,
pressure.
and arnica.
Arnica as well,
We would have them take some arnica ahead of time, and one of the things after the treatment, what do you treat the patient's face with as soon as I'm done with the treatment?
As soon as we're done, we'll put topical arnica that's nice and cool,
Right.
And we massage the areas that you've just injected. So.
Exactly. So, you know, we're now, as we've learned, okay, so we're doing all the maneuvers to help so that you have basically no downtime with this.
Right.
You know, you might, as with anything, Botox, Dysport, any kind of injectable, there's always a little risk of a bruise, but I have found that not to be an issue on all the patients, and I've been injecting a lot of patients with our injectable hydrator, which is SkinVive, and I will tell you that what I saw in our practice administrator, who's a Gen X age, okay, was that her skin was plumper, but the fine lines around her mouth, okay, those fine lines were less. I'm not going to tell you they're going to go away, okay? We don't believe in over-promising here, but I will absolutely tell you that they will look softer, and that's been my experience. Most of our patients that I have injected this on, the SkinVive, have been more Northern European skin types, and I follow up with them with either a phone call or a text message, and I will tell you that I have not had one negative comment about it, and that the patients really love this. So you're right. And what's so great about it is that it's great for all ages.
Yes.
I do know that as I study generations, I even have a book that I'm reading right now on generations and the different, and the, you know, just how we're brought up and we're affected by the environment that we grow up in. That the young generation, your generation, which generation is that?
I'm on the cusp. I could be the youngest millennial, but also the oldest Gen Z. So
you like to be young, so you want to be a young millennial, but I actually think you're a Gen Zer, so you're a zillennial.
Kind of in there, yeah.
Okay,
right
so
in
you're a zillennial, and right is that I'm really impressed with the younger generation in terms of skincare.
Yes.
They're focused on skincare versus those baby boomers who are putting on baby oil and trying to be out in the sun and bake. So I love the fact that your generation, Karina, is into skin health.
Of course.
So SkinVive, absolutely, injectable hydrator. I think it's a fantastic treatment for the skin. What other? So we talked about, you know, my kind of what my new excited. I'm just so favorite treatment to do, at least for now.
Yes, of course.
What other kind of items are of concern? What's our other cosmetic
I think
concerns?
patients really want to feel like they have a refreshed look as we're moving into just feeling a little bit more natural, more awake. And one of the concerns that both men and women have is their under eye area and them feeling like it's a little bit hollow, or they just look like they're tired, or even sometimes grumpy or angry because they have that area has deflated, or puffiness of the back.
That resting, I'm not friendly face, right?
Yes.
Right. We're on the radio here, so we have to watch what we say. But that resting, I'm not friendly face. And you're right, it's interesting because I know we're going to talk about another cosmetic concern, but I would have to say that the under eye hollowing or brown spots, looking tired, that's pushing the number one spot in patient concerns, okay? And so I would agree with you, and we have tried all sorts of things. We have tried filler under the eyes, and it can be done, but less is more. If you try to fill up too much, it tends to get lumpy, and that's not a good look. And the whole trend now in cosmetic medicine is for a natural look. Everybody wants to look natural. They don't want to look done. And for me, I say thank God, because that's always kind of been my philosophy anyways. We're kind of getting away from the huge lips or all these exaggerated looks. And so filler under the eye a little bit can be good. We were looking at using our own blood products called PRP, which is platelet-rich plasma, and it's where we spin down, after a blood draw, we spin the blood down and we take a portion of the serum that is high in platelets, because it's called platelet-rich plasma, and we were injecting it under the eye, and I was noticing some improvement in skin with that, but not a lot of volume to correct the under eye hollow. Okay, so we then, and I love just cosmetic medicine because how everything is just, we're constantly working on it, right? We're evolving. I love your word, evolving. We're constantly evolving and trying new things, and so we've moved on to something where you're a big part of the treatment, Karina, right? You're my mad scientist, and I'm going to explain this in a minute, but it's easy, like elephant zebra, easy PRF gel, right? And it's a fantastic treatment for treating under the eye. So it is a combination of PRP, platelet-rich plasma, which we activate, so now it becomes PRF, or platelet-rich fibrin. And you hear fibrin, so that makes you think collagen, okay? And then taking protein from the blood and pulling out albumin, and this is where we ask the birthday girl, so what is albumin, Michelle?
Albumin is like the protein in an egg. It's the egg white.
Egg white, there you go. Excellent, thank you. So we take the albumin and we mix the PRP and the albumin together and inject it under the eye, and so we're getting not only improvement in how the skin looks under the eye, Karina, but we're actually seeing some volume being restored, which makes us look more youthful and looks more rested, okay, and makes us, instead of the not so friendly resting face, we look more like the happy, I want to meet you and talk to you face, right? So tell me, how do we proceed with, or how do we perform easy PRF gel treatments? Because you are a huge part of this.
Well, the patient initially starts with me. We want you to be very well hydrated. Just like your skin needs to be hydrated, your body needs to be hydrated to give us a good amount of blood.
Okay.
And then we will start with the blood draw. I'll spin it down, cool one side, heat one side, and mix it together. Okay,
so why are you, so you're drawing two syringes?
Two different tubes.
Two tubes, okay. So why are you cooling one side down?
One we're trying to keep from clotting.
So that's the PRF,
that's
correct?
The PRF,
okay.
And it's kept cool until it's ready for mixture with your albumin, or your, for me, color coordinated. So one is blue, one is red.
Okay, so which one is the blue one?
The blue one is your PRF.
Okay, so that's your platelet-rich fibrin, and you're keeping it cool, so you're keeping it from being too active, correct?
Exactly.
You're putting it to sleep?
Exactly.
Okay.
You want it to rest.
Okay, so you can tell right now that Karina's, I say this to my patients all the time, she's our mad scientist, and she's working away in the lab. So the other tube is what which color?
That is a red top,
Okay.
but they're both yellow in color.
Okay.
Once it's spun down, and that one we're heating. That's our, as Michelle would say, our egg.
Okay, our egg white. Yes, the albumin.
Our albumin, and that is heated usually for about 12 minutes until it turns into a gel consistency.
All right. So you have a timer. You time that?
Yeah, we do. I either ask my watch, my handy dandy watch, and ask for a timer, or we have a little egg, actually, an egg timer.
I didn't realize that it was an egg timer. Okay.
It is an egg timer.
All right. So we have a timer, and you warm it up, and so now we're going to be extracting the gel or the albumin out of there. So what is then? What's the next step? So now the timer goes off. Now what do you do?
Well, the timer's off, so now it's been solidified. So our albumin is solidified.
So it's a gel
in a syringe.
Right.
It is a gel.
Okay. So not a hard. I'm going to knock. Okay. It's not a knock like a hard table, but it's a gel.
It's definitely a gel consistency. Maybe like Jell-O consistency,
okay,
I would
right.
say.
Yeah, I think
to.
that's a really good.
And we also want to
analogy.
let that cool before we're injecting into this.
So we take that and then you mix the two.
I will mix the albumin with the PRF that's been cooling, and I usually wait until you come in and greet the patient and get your talking down, so that we don't have any clotting happen.
Poor Karina is so patient. That's a wonderful and lovely part of her, because she has to listen to me tell the same jokes or stories or whatever that I'm doing with patients, and she waits there patiently, I think. And I can't tell sometimes when she has a mask on. But we chat with the patient about what their expectations are, and so at that point in time, then you're mixing the two. And about how many syringes do we usually end up with?
It varies. It's usually 4 syringes of 1 mL.
Okay.
So a total of 4. If we get lucky and the patient is very hydrated, then we get 5.
Okay. All right. So hydration actually improves your
really
results.
Does. Yes, it really does. Yes.
So we take that, I freeze up the skin, we make a tiny little hole with the tiniest needles, and then we take the syringe hooked up to a cannula, which looks like a long needle, but it's blunt, and I take that and I slide it underneath the skin, sometimes a little bit deeper on the under hollow of the eyes, and we inject easy PRF gel in that area. I will sometimes inject it a little bit into the cheek area just below, or sometimes just on the side of the eye. So if you put your fingers up to the side of your eye, right in that area, it can be hollowed as well, and I'll inject that area with the easy PRF gel. Michelle, you have a question?
I just want to ask about that process. The patient, you do this under local, right?
We actually do a local injection on the skin, but we don't even have to inject local underneath at all.
Okay. Yeah. Is it weird to have things happening right underneath? Can you see that when the process is happening as the patient?
I can see it because I'm doing the injection, but the patient doesn't see it.
They don't
and
see
they
it.
tolerate it completely.
Yeah.
It's not weird
just
for them at all.
I'm thinking like needles and things underneath my eye would kind of freak me out.
That's a cannula, and actually patients do great with that.
And you're laying down and you're relaxed and your eyes are closed.
What do we use to distract the patient if we're sort of
use
a pain tolerance?
It's a vibration distraction device, so most people are pretty comfortable.
Right. Yeah. We use that, and we also, if needed, we also have a combination of nitrous oxygen and nitrous and oxygen, although I have to say nobody really needs it because
it's a rare.
It's very, very rare that somebody has any issues with that. So you end up, after the easy PRF gel, with revolumization and the skin looking better. Normally what we recommend is that, and the advantage of this is because of the gel, the PRF is embedded in the gel, Karina, and it's released over several weeks versus just injecting PRF as a serum and having it either affect right away but then be diluted by the body. So that's the beauty of this technique. And when we do this, we're going to see improvement over the next couple of weeks' time. Initially a little bit swollen, but not much. And we will then recommend the patient have a second treatment about 3 months out after that. And then how often are we usually recommending it for them?
Just depending on how the patient feels, but once a year, if that.
I would agree with that. I think once a year. I wouldn't tell somebody, oh, well, this lasts me 2 or 3 years. I'm going to say no. But you do one treatment at about 3 months, and then after that, once a year I think is very reasonable. But again, it depends on how hollowed out you are. Okay, Karina would probably just need one treatment. For me, I need maybe 1.5 treatments. Other people might need 2 treatments for that. So that's our second technique. What's our third technique? That or third concern, I should say, for our patients.
I think that as people begin to age and lack of volume in the cheek area, most women do not like the area of the marionette or the jowl lines that are seen.
Right. So we talked about the under the eyes, like number 2, and approaching number 1 complaint or concern in patients, but absolutely the jowls. And we have people as early as in their late 20s or 30s who will tell us about that issue. And so again, getting back to our natural techniques of before we would inject filler in that area, and it still works very well. But we're looking at the fact that the face deflates, okay? And if you look at yourself, Karina, and you're so very young in your 20s, but when you were in your mid-teens, your face was probably a little bit rounder, had a little bit more fat.
Definitely
okay,
rounder.
Yeah, right, okay.
Yes.
And not just because you're Latino, I think that's probably true of most
rounder.
people. And then as you get older, you like it because your face loses a little bit of volume, becomes a little more sculpted. But then, of course, we don't get to keep that forever, and then we continue to lose more and more volume, and then we begin to see things like jowls, right? And so one of the treatments which I love, it's a biostimulatory, is Sculptra. And Sculptra works great. So Sculptra is a powder which mixed in sterile water and is injected under the skin, okay? Actually creates collagen. It creates a volume, and using Sculptra, Karina, is a great way to add more volume to the face in a natural way. And in fact, I was talking to, and just so people will know how I feel about Sculptra, I'm looking at Karina. She's a beautiful young lady in her 20s, and I'm saying, as you get into your 30s and so forth, what might be your game plan? What is one of the treatments that I recommend for you? Is Sculptra, right? Because it's so natural looking. And hey, guys, for you out there, this is great for men because we're really afraid of looking done, right? Or looking feminine when we get a treatment. So the Sculptra really works well. And for you, Karina, that might be where I might recommend that we inject the cheek and the hollows around your jowls and so forth. And you might do that 1 year, and then it might be a couple of years down the road that you might, because you're so young. For me, I'm going to need a couple of treatments in a short period of time. Karina, we're running out of time.
I'm
sorry.
So much to talk to about.
I know.
Not enough time.
Okay, so on the Karina and Dr. Tom show, can I get you to come, or can I come back on your show?
I'll be back. You guys can't get rid of me that easily.
All right, so that's what we're going to do. So what we're talking about is SkinVive, which is the injectable hydrator for the skin. We talked about Easy PRF Gel for under the eyes, and we talked about Sculptra to give you natural revolumization of your face. I want to thank you, Karina, for coming, and Michelle for producing our show, and happy birthday, Michelle.
Thank you so much. Reach out to Dr. Tom and make a free consultation appointment at 707-542-8346.